Imagine taking a standard, an everyday dietary supplement during pregnancy, just thinking you're ensuring your baby's health.
Right, do what you're supposed to do.
Exactly. But then imagine discovering 3 years later that this exact vitamin fundamentally altered the neural formation of their brain.
Yeah, and leading to measurably worse behavior. It's wild.
And we are not talking about some fringe experimental drug here, right? We are talking about vitamin A.
Yeah, good old vitamin A.
Right. So today, in this deep dive, we are looking at a massive stack of clinical research that honestly, it completely shatters that quaint, wholesome, eat your carrots for good eyesight myth.
Oh, absolutely.
Because what we're looking at is a highly complex, double-edged physiological multi-tool.
It really forces a complete reframing of how we view our daily intake.
Mm.
Because the clinical data, it reveals that vitamin A is arguably one of the most powerful and undeniably one of the most temperamental compounds our bodies rely on.
Temperamental is a great word for it.
Yeah, I mean, it acts as a master regulator for everything, from autoimmune responses in conditions like multiple sclerosis, all the way to the literal architectural development of a fetal brain.
Okay, let's unpack this.
Right.
Because to really grasp these wild behavioral outcomes and, the chronic disease interventions, we have to establish the mechanical ground rules of how this compound actually behaves once you swallow it.
Right, the basics.
Yeah, because as anyone who follows nutritional science knows, vitamin A isn't just one single thing, is it?
No, not at all. We are dealing with two very distinct molecular formats, and they metabolize completely differently in the body.
And that structural split is pretty much the foundation of everything we're going to talk about today, right?
It is, yeah. So the first form is preformed vitamin A, or retinoids.
And this is the one from animals.
Exactly. You find this in animal products, meat, poultry, fish, dairy, and, most potently in liver. Then the second form is provitamin A. These are primarily carotenoids, like beta-carotene, which you get from plants. Your spinach, sweet potatoes, and carrots.
Okay, so the way I was thinking about this when looking through the sources, beta-carotene, is essentially flat pack IKEA furniture.
Huh. I like that.
Right. Like it has all the necessary pieces in the box, but your body actually has to put it together and convert it into a usable chemical format first.
That's a perfect way to look at it.
And then eating a piece of liver, that gives you the preformed vitamin A, which is the fully assembled chair.
Right. No assembly required.
The body can just sit right in it and use it immediately.
Exactly.
Yeah.
And that conversion bottleneck, for the plant-based flat pack version,
Yeah.
it dictates the entire daily intake structure.
Which is where the numbers get a little confusing for people, I think.
They really do. So the National Institutes of Health bases its recommendations on retinal activity equivalents, or RAEs.
RAEs, got it.
Yeah, and for anyone 14 and older, the target is between 700 and 900 micrograms of RAEs per day.
Okay.
And that bumps up to around 1,300 for breastfeeding women.
And here's the annoying part for you as a consumer. The nutrition labels on your cereal boxes or vitamin bottles, they don't use RAEs. They use international units or IUs.
Right, which makes it super confusing.
Yeah. They set the FDA daily value at 5,000 IUs. And honestly, trying to do that math in the grocery aisle is just impossible.
Completely impossible. Nobody is doing that math.
But the overarching consensus in the sources we looked at is that pushing those limits with high-dose supplements, specifically with the fully assembled preformed vitamin A, that crosses a very dangerous line.
It really does. Pushing past the upper limit, which is about 10,000 IUs of preformed vitamin A per day, it triggers severe systemic toxicity.
And we're not just talking about a mild stomach ache here.
No, not at all. The clinical literature documents cases escalating from, dizziness and nausea, straight to severe headaches, coma, and even death.
Wait, death. From a vitamin?
Yes, because the compound accumulates in the liver. It's fat-soluble, meaning your body stores the excess rather than just flushing it out in your urine like it would with vitamin C.
Okay, so how does an everyday vitamin actually become a lethal toxin? Like, mechanically, what is happening?
Well, in high concentrations, preformed vitamin A destabilizes cellular membranes.
Oh, wow.
Yeah, it essentially acts as a solvent. It causes the membranes of your cells, and we're talking about cells in your central nervous system too. It causes them to just break down.
That is terrifying.
It is. And this is why the sources explicitly warn that females who may become pregnant must absolutely avoid high doses of preformed vitamin A.
Because of the teratogenic effects.
Exactly.
Yeah.
Teratogenic meaning the potential to cause birth defects.
Yeah.
Those effects are profound when those cellular membranes are compromised during fetal development.
Okay, but meanwhile, the flat pack version, the provitamin A from your carrots and sweet potatoes, that doesn't carry the same lethal risk, does it?
No, thankfully. If you eat a massive excess of beta-carotene, your body just kind of says, okay, we have enough, and stops converting it.
Though you do run the risk of carotenodermia, which I found hilarious in the sources,
Oh yeah, that's a very real thing.
where the unconverted pigment literally deposits in your skin and turns the palms of your hands and the soles of your feet this distinct yellow-orange color.
Right. It's completely harmless, but it's a clinically fascinating, visible marker of that metabolic bottleneck we talked about.
Okay, but pushback time. Since we're establishing that severe deficiency is relatively rare in places like the US, why should you, the listener, be deeply concerned about getting enough?
Well, we have to look at the global economic reality of nutrition to really understand how fragile that baseline sufficiency actually is.
Right.
There was a cross-sectional study analyzing data from the Indonesian nutrition surveillance system, and it was huge, covering nearly 43,000 households.
Wow, that's a massive data set.
It is. And they mapped food expenditures against the incidence of night blindness in non-pregnant women of childbearing age.
Night blindness being like the classic, immediate clinical indicator that the body is starved of vitamin A.
Exactly. And the data showed this direct, unyielding correlation. Families who were forced by economic pressure to spend more of their income on cheap, filling grain foods.
Like rice, right?
Yeah, mostly rice. If they spend more on that and less on diverse animal and plant-based foods, they experienced a significantly higher risk of night blindness.
So deficiency isn't just some geographic anomaly. It's actually an economic tripwire.
That's a great way to put it.
When food prices surge, a whole population can slip into systemic deficiency just by defaulting to inexpensive grains that lack that nutrient profile.
It really underscores that maintaining the required systemic levels, it requires continuous access to dietary diversity.
Okay, so if economics can trigger a deficiency on a population level, the clinical case studies show that physical malabsorption can do the exact same thing on an individual level.
Yes, absolutely.
Because even with a perfect diet and, unlimited economic resources, if your gut mechanics are broken, you are functionally starving.
And this loops back to that critical mechanism we mentioned earlier. Vitamin A is fat-soluble.
Right.
It requires dietary fats to act as a carrier, and it requires a fully functioning gastrointestinal tract to break it down.
Specifically the bile salts and pancreatic enzymes, right?
Exactly. Those are needed to absorb it into the lymphatic system.
Mm-hmm.
So if your gut is structurally compromised, the vitamin just passes right through you.
Which brings up a really fascinating report we saw from the Cleveland Clinic.
Oh, that case study was incredible.
Yeah, they treated a 6-year-old man who was suffering from severe nyctalopia progressive night blindness, and his labs showed markedly depleted vitamin A levels.
But it wasn't his diet.
Right. The underlying mechanism was a long history of Crohn's disease that resulted in multiple bowel resections. He was literally missing the physiological real estate required to absorb the vitamin.
And the clinical intervention in a case like that is highly complex. I mean,
Mhm.
standard oral vitamins totally failed because he couldn't absorb them.
So what did they do?
The medical team had to rely on parenteral supplementation.
Meaning injections.
Yeah, injecting the vitamin directly into his body to completely bypass that broken gastrointestinal gateway.
And there was an even more extreme case in a Spanish medical journal, a 48-year-old woman who had undergone 3 bariatric weight loss surgeries over a few years.
Right, and bariatric surgery intentionally alters the digestive tract to restrict absorption.
Exactly. But her health completely collapsed. She developed severe asthenia, which is this profound, devastating loss of strength and energy.
Yeah.
Plus, swelling in her lower limbs, hearing loss, painfully dry skin, and xerophthalmia.
And for those who don't know, xerophthalmia is the progressive inability to see in low light.
And it leads to blindness, right?
It inevitably leads to total blindness if left untreated, yeah. Her body was just experiencing this cascading multi-system failure.
Just from missing this one vitamin.
Yes. Her most severe deficiency was vitamin A. And once they initiated a high-dose treatment, all of those terrifying symptoms vanished within 6 months.
So what does this all mean? When we look at that cascade of failures, the skin, the ears, the eyes, the core energy levels, What is vitamin A actually doing inside the body to cause such widespread collapse when it goes missing?
It all comes down to cellular proliferation and cellular differentiation.
Okay, break that down for us.
So vitamin A isn't just floating around in your blood doing nothing. It enters the nucleus of your cells, it binds to specific receptors, and it acts as a transcription factor.
A transcription factor, meaning it interacts with the DNA?
Exactly. It essentially reads your DNA and issues instructions. It tells a raw, immature stem cell what specific type of tissue it needs to become.
Wow.
Yeah, so without it, your cells literally lose their instruction manual. They stop differentiating correctly, barrier tissues like skin and mucous membranes break down, and your immunological defense grid basically goes offline.
Which opens the door perfectly to the most surprising clinical research in our stack, I think.
Oh, definitely.
Because once you understand that vitamin A is basically a genetic instruction manual, its role as a systemic shield against chronic disease finally makes sense.
What's fascinating here is watching this single nutrient intervene across a spectrum of conditions that seem entirely unrelated until you look closely at that underlying cellular dysfunction.
Right, like that double-blind study out of Iran.
Yes, the multiple sclerosis one.
Yeah. They focused on 101 outpatients with relapsing remitting MS. And MS is an autoimmune disorder, right, where the immune system attacks the central nervous system.
Correct. And what they found was that after 6 months of vitamin A supplementation, the patients experienced significant measurable improvements in fatigue and depression.
Which are two of the most debilitating psychiatric manifestations of the disease.
Exactly. And the researchers pinpointed vitamin A's role as an immune modulator.
Because it's regulating those cellular instructions.
Yes. It can actively tone down the aggressive, hyperactive immune cells that drive the autoimmune attack. And simultaneously, it promotes the regulatory T cells that keep the immune system in check.
And that genetic regulation, it extends into oncology and metabolic disease, too.
It really does.
We looked at a study out of China that matched over 600 subjects with primary liver cancer against healthy controls.
Yeah.
And they found that a moderate intake of retinol and carotenes significantly lowered the risk of developing liver cancer.
And we saw something similar with diabetes.
Yeah, that massive 10-year study from the Netherlands tracking nearly 38,000 people.
Right, and they found a distinct inverse association between two specific carotenoids, beta-carotene and alpha-carotene, and the risk of type 2 diabetes.
So the higher the intake of those plant-based carotenoids, the lower the risk of metabolic dysfunction.
Exactly.
And this isn't just for adults. We see dramatic impacts in younger populations, too.
Oh, the acne study.
Yeah. A clinical trial in Kosovo gave low-dose vitamin A to 50 patients with moderate acne for 3 months, and they saw a 90% clearance rate.
With incredibly low relapse during a 2-year follow-up. That's huge for acne treatment.
It is. And then there was a case-controlled study tracking over 6,000 adolescent girls. They found preliminary evidence that higher carotenoid intake lowered the incidence of benign breast disease.
Which is a known independent risk factor for breast cancer later in life.
Right. But I have to stop you here because, it's hard to reconcile all this.
I know what you're going to say.
Like, how does one compound treat multiple sclerosis, liver cancer, type 2 diabetes, and teenage acne?
It sounds crazy, right?
Biologically, those are vastly different conditions. What is the common denominator here? Are they saying vitamin A is a magic cure-all? Because it sounds dangerously close to snake oil.
I get it. It does sound like a magic bullet until you realize that cancer, acne, and autoimmune disorders are all fundamental failures of cellular behavior. Think about it. Cancer is uncontrolled cellular proliferation. Acne involves the hyperproliferation of skin cells blocking pores. Multiple sclerosis is a rogue immune cellular response. Because vitamin A is the transcription factor that governs how cells divide and mature. Maintaining adequate levels just ensures your body has the raw materials to enforce normal, healthy behavior.
So it's not curing the disease itself.
Exactly. It enforces cellular discipline across every organ system.
It's like the biological project manager keeping all the contractors on schedule.
That's a perfect analogy.
But there is one area of human biology where this powerful regulation becomes a highly delicate, paradoxical tightrope.
Yes, the generational paradox.
Right. Pregnancy and infancy. The findings in these sources were just staggering.
The clinical data surrounding interventions during pregnancy and the postpartum period is incredibly nuanced, especially starting with maternal supplementation and breast milk.
Yeah, we looked at 2 major systematic reviews covering over 25,000 women and infant pairs. And they investigated the impact of giving postpartum mothers vitamin A supplements.
Which makes sense logically, right?
Totally. The hypothesis is straightforward. Supplement the mother, enrich the milk, improve the baby's health outcomes.
And the data did confirm the first part. Maternal supplementation significantly increased the vitamin A content in the colostrum and breast milk.
But the paradox is that this enriched milk did not translate into any measurable clinical benefit for the infants.
Right. When they compared them to a placebo group, the supplemented infants showed no improved outcomes regarding mortality or morbidity.
So their nutritional status improved on paper, like in their blood work.
But it didn't change their actual health trajectory in the real world.
It's a highly successful biochemical intervention that delivered zero real-world results.
It's frustrating from a clinical standpoint.
And we see a similar, though honestly more painful, contradiction with very low birth weight infants.
Yeah, this part of the research is tough to read.
There was an analysis reviewing data on over 1,400 premature infants, and they were subjected to multiple, highly painful intramuscular injections of vitamin A to support their fragile development.
The clinical calculus here is incredibly difficult for neonatologists because the intramuscular injections did provide a modest physical benefit.
Right, they slightly reduced the risk of death, lowered the need for supplemental oxygen, and reduced the incidence of chronic lung disease.
But when the researchers evaluated the infant's neurodevelopmental status over time, they found zero evidence of benefit.
Nothing.
Nothing. The agonizing pain of repeated intramuscular injections yielded a slight respiratory advantage, but it completely failed to offer any neurological protection.
It just forces medical professionals to weigh a modest physical survival advantage against the immediate trauma of the treatment.
Knowing all the while it won't aid the brain's development.
And here's where it gets really interesting. The final study in our stack takes that neurological concern and amplifies it to a startling degree.
This is the Japanese study, right?
Yes, a prospective study tracking over 1,200 pregnant women and their newborns. They meticulously tracked the mother's dietary and supplemental intake during pregnancy.
And then they followed up 3 years later.
Right. To evaluate the children's psychological development using a child behavior checklist.
And what the researchers discovered was a definitive inverse association. The mothers who consumed higher levels of vitamin A supplementation during their pregnancy had children who exhibited more negative behavioral patterns at age 3.
Which is just wild to me. The very compound deemed essential for the anatomical development of the fetus actually resulted in a negative behavioral deviation 3 years later.
It is wild.
How does the biological project manager cause the system to fail this dramatically?
Well, the researchers point directly back to that teratogenic threat we discussed in the beginning.
The toxicity.
Exactly. Because excess preformed vitamin A accumulates and becomes toxic, it fundamentally alters the signaling pathways during embryonic development.
So it's messing with the instructions.
Yes. The hypothesis is that even slight chronic excesses of preformed vitamin A during that delicate window of gestation can subtly alter the neural architecture of the fetal brain.
Meaning it changes the way the neurons wire themselves together.
Exactly. It's not causing a visible structural birth defect,
Right.
but it is microscopically rerouting the brain's internal circuitry, which then manifests as measurable behavioral issues years after the child is born.
It is the ultimate testament to the Goldilocks principle.
Absolutely.
When properly balanced, vitamin A is the crucial instruction manual for cellular health, immune defense, and vision. But pushing those levels too high, particularly through preformed synthetic supplementation during pregnancy, it risks fundamentally rewriting the neural blueprint of the next generation.
It is a magnificent vital compound that demands absolute respect.
Yeah, it is not just another daily gummy vitamin you can blindly swallow without considering the metabolic consequences.
Definitely not. And, if an excess of a single common everyday vitamin taken during pregnancy can subtly alter the neural formation of a fetal brain, enough to measurably change a child's behavior 3 years later.
Yeah.
What other seemingly mundane everyday dietary choices are we making right now that are quietly reshaping our long-term cognitive functions and personalities without us ever realizing it?
Oh, wow. That is a profound and honestly slightly unsettling thought to take with you the next time you are standing in the supplement aisle.
Good luck out there.
Truly. Well, thank you for joining us on this deep dive. We'll catch you next time.
Until then, stay curious.